Good afternoon. I would like to thank you all for being here today for this webinar. My name's Cassie Scott, and I'm going to provide a brief overview of the protocols and policies we follow at my hospital here in New Zealand relating to injuries sustained in the perioperative environment. A little bit about me to get started. I have been a perioperative nurse since 2005 and have practiced in several countries across the globe. Currently, I am in New Zealand where I lead a perioperative team. I'd like to start by providing some statistics on the pressure injuries sustained in New Zealand. As you can see here, each year it is predicted 55,000 people in New Zealand will acquire pressure injuries, and that equates to somewhere between 4 to 8% of all people receiving healthcare. As we all know, the majority of pressure injuries are preventable, and there is a personal wellbeing impact on those affected and a financial impact on the healthcare system, which is significant. So pressure injuries significantly impact the quality of life for our patients as it increases the risks of mortality and morbidity. It negatively affects mental well-being, and the physical injury in many cases prolongs hospital stays and can even result in death. In New Zealand, the financial impact of treating these injuries is estimated at approximately 385 million euros per year, which is a significant sum. And I should also mention too that in New Zealand we have something called ACC, which is the Accident Compensation Corporation, which is an authority which provides cover to anyone injured in an accident in New Zealand. And pressure injuries such as these is covered under the ACC. So this page shows some images taken from our Health Quality and Safety Commission. It not only shows the tens of millions of dollars spent each year treating grades 1 to 4 pressure injuries. Now this not only is measured in treatment costs, but it also takes into account the additional length of stay and rehabilitation costs involved with a pressure injury. The second image shows the National Pressure Injury Education Program, and this was introduced around 8 years ago, I believe. It's a national program whereby all hospital districts are required to report their pressure injury data quarterly to the Commission. However, you'll see here that there's an action plan and its solution areas which focus on prevention of these injuries, and they can be prevented by streamlining clinical practices throughout the country, improving support systems, giving authority to those in clinical areas to access the appropriate equipment, and building the leadership culture. So now I'd like to explain our process for pressure injury prevention in my hospital. From a nurse ward perspective, currently our hospital uses the Braden pressure risk assessment tool, and our policy states that risk assessment has to be done within 4 hours of each hospital admission, and when a patient's condition changes, for example, if they deteriorate or if their condition improves. For our perioperative team, we do a few things. Our nursing team conduct a skin integrity assessment preoperatively and postoperatively prior to transfer to the post-anaesthetic care unit. And this is all documented on our perioperative paperwork, which we'll see in a few slides' time. The nurse thoroughly assesses the patient to identify risk factors for patient positioning injuries. So, for example, age, body mass index, an evaluation of the patient's pre-existing conditions and comorbidities which may impact their positioning requirements. Prior to commencing surgery, our team work collaboratively to decide on the most appropriate pressure injury prevention aids. So patient positioning is a team effort, and we ensure that the patient is placed on a smooth, wrinkle-free surface with pressure redistributing padding, making sure that towels, sheets, and other inappropriate items are not used for positioning aids. If an injury occurs during the intraoperative period, we report these immediately via our digital reporting system. All of our team members are involved in our 6-monthly safe positioning audit, and some of these team members conduct the audits themselves, and all team members have distributed the results. All perioperative team members must undertake yearly mandatory education, and this is not only in manual handling and correct body mechanics, but it's also on pressure injury prevention, methods, and education sessions from our wound care team. This is our current ward-based nursing paperwork. On the left is our pressure area risk assessment score. As I mentioned earlier, this is completed on admission and then continuously throughout the patient's hospital admission. On the right is our pressure injury investigation tool, and this assists the team to ensure all relevant tasks are completed and required paperwork is completed for that patient. It's the tick box just to ensure that we've got everything done. Now this is a sample of our perioperative paperwork which our nursing team complete, and as you can see where the green arrow is, this is for our ward staff to complete and give a brief explanation of the skin integrity preoperatively. And then our nursing team, as I mentioned earlier, go in and do a full skin assessment. On this page there's more space for our team to accurately document skin integrity pre and post-op, positioning, padding and protection used. This is then used to assist the team when providing a handover to our post-anaesthetic care colleagues. And we have a tick box on this page, and it's also a space to do some free writing, and it's to ensure that it's as easy as possible for our staff to complete accurately. So you can see there for surgical positioning, all you have to do is tick the box. For padding, you tick the box and then there's a space to write whatever you need to do. The easier it is for the team, the more likely it is for it to be completed accurately. Now there's always room for improvements, and here are some of my thoughts on what I would like to do to improve our response to pressure injuries and prevention in our unit. I would like to introduce a perioperative pressure injury prevention champions, and these will be nurses that role model to the other team members and advocate for best practices and latest initiatives to be implemented in this field. And secondly, I would love the opportunity to introduce a perioperative specific pressure injury prevention education package that's relevant for our team members, as currently all of our training is very much ward nursing based. And that's it for me. Here are my contact details and some links to references that I've spoken to during this presentation. Again, thank you so much for your time and your interest in improving the standard of perioperative care for our surgical patients. Thank you.